Don't ignore these 8 nighttime signs of diabetes. Did you know your body could be screaming about diabetes while you're asleep, and you might not even hear it? That line might sound dramatic, but it's true. Many people think diabetes only shows up through daytime symptoms like fatigue or sugar cravings. But the real warnings often hit hardest at night. In this video, I'm going to tell you about 8 nighttime signs of diabetes that most people completely ignore. If you've been waking up feeling more tired than when you went to bed, or getting thirsty in the middle of the night without any reason, it's time to pay attention. And if you relate to any of these symptoms, make sure to consult a healthcare professional for proper testing and guidance. Now, let's get started. 1. Frequent nighttime urination, Nocturia. When you're waking up in the middle of the night just to pee, not once, but maybe 2, 3, or even 4 times, it might feel like an annoying part of aging, or maybe something you drank. But if it's happening often, and especially if it disrupts your sleep regularly, it's time to take it seriously. Frequent nighttime urination, or what doctors call nocturia, is one of the most overlooked early warning signs of diabetes. When blood sugar levels get too high, usually above the renal threshold, your kidneys kick in to help clear that extra glucose from your blood. But glucose can't leave alone, it pulls water with it. That means the more sugar your kidneys try to flush out, the more water you lose through urine. This is why you feel the urge to go again and again, especially at night when your body is supposed to be in a resting state. Your bladder fills up faster than it should, pushing you to wake up just to empty it. But there's more to it than just the kidneys doing cleanup duty. High blood sugar also affects the hormones that regulate your body's fluid balance. One of those is vasopressin, the hormone that usually helps your kidneys hold onto water during the night so you may sleep uninterrupted. But in people with uncontrolled diabetes, vasopressin signaling gets weaker. The result? Your body stops conserving water like it should, and you keep producing more urine than normal, even if you haven't had anything to drink before bed. According to Frontiers in Public Health, people with diabetes are 49% more likely to wake up at night to urinate. The risk is higher in men and more common in Asian populations. Even getting up just once at night may be a warning sign. 2. Intense thirst during the night. One of the clearest signs of undiagnosed or uncontrolled diabetes is intense thirst during sleep hours. And once you understand the science behind it, you'll see it's not just about being a little parched. It's a sign your system is under real stress. It all starts with excess sugar floating around in your bloodstream. When blood glucose levels rise too high, your kidneys go into overdrive trying to flush that sugar out. But glucose doesn't travel alone. It drags water with it, and that water has to come from somewhere. So your body pulls fluid from your tissues, dehydrates your cells, and ends up leaving you dry, inside and out. As that water exits your system, your brain gets the message loud and clear. You're dehydrated, and it triggers your thirst response even while you sleep. But thirst at night isn't just about fluid loss. There's also a hormonal angle that gets disrupted when diabetes enters the picture. Normally, your hypothalamus, which is the part of your brain that manages thirst, works with your kidneys to keep your hydration levels in balance. It uses feedback from blood osmolarity, or how concentrated your blood is, to decide whether you need water. In diabetes, the constant sugar overload confuses this system. Your blood becomes thick with glucose, falsely signaling the brain that you're dangerously dehydrated, so even if you've had enough to drink, you still feel unbearably thirsty. According to clinical diabetes and endocrinology, many people fail to recognize early signs of diabetes, like constant thirst. In a French study, only 36% linked symptoms to diabetes, while others focused on family history or ignored the signs. 3. Restless legs or tingling sensations. Restless legs and nighttime tingling sensations are often early signs of something deeper, and diabetes is one of the most common hidden causes behind them. When your blood sugar stays elevated for long periods, it begins to damage the tiny blood vessels that supply your nerves, especially those in your legs and feet. Without a steady flow of oxygen and nutrients, your nerves start misfiring. That's when you feel the pins and needles, that buzzing, or even the creepy crawly sensation that doesn't let you rest. This type of nerve damage, called peripheral neuropathy, usually starts subtly, but may progress quickly if left unmanaged. Now, unstable blood sugar levels don't just damage the nerves, they actually change how your nerve cells behave. When glucose builds up inside nerve cells, it triggers oxidative stress, which is like cellular rust. That stress makes nerves hypersensitive, firing off random signals even when there's no reason. So while you're lying down trying to sleep, your legs might be telling your brain they're in pain, even though there's no physical injury. That electrical confusion is exactly why you feel restless at night, and why the discomfort often gets worse when you're still. According to research, people with diabetes have a higher risk of restless legs syndrome, often mistaken for nerve damage. A 65-year-old woman with type 2 diabetes suffered poor sleep for 10 years before proper RLS treatment quickly improved her symptoms. 4. Excessive night sweats. Excessive night sweats are one of those warning signs of diabetes that many people miss, mostly because they seem so random. But when you break down the body's chemistry, there's a clear reason why this happens, and it's all about how your system responds to glucose imbalances while you sleep. When your blood sugar dips too low during the night, your body sees it as a crisis. It reacts fast by releasing stress hormones like adrenaline and cortisol to bring your glucose back up. But this hormonal surge doesn't just balance sugar. It also triggers your fight or flight response. That's what leads to the intense sweating, rapid heartbeat, and even vivid dreams or shakiness. And since blood sugar lows often go unnoticed while you're sleeping, these sweats may be one of the only signs your body gives you that something's off. What makes it even trickier is that you don't have to be taking insulin or medication to experience these drops. In type 2 diabetes, the body's own insulin regulation becomes erratic. Sometimes it overcorrects, especially after late-night meals or snacks. When your insulin spikes too high, it may cause a blood sugar crash a few hours later, often right in the middle of your sleep cycle. That drop sets off internal alarms, and your body answers with a flood of stress responses that leave you soaked in sweat without you even realizing why. According to an author manuscript, postmenopausal women with night sweats or hot flashes had an 18% higher risk of developing diabetes. The risk was stronger with severe symptoms, longer duration, and night sweats starting after menopause, even without obesity. 5. Waking up tired despite a full night's sleep. Feeling exhausted despite a full night's sleep may be one of the most subtle but important warning signs of diabetes. It's not just about poor sleep quality, it's about how your body is struggling behind the scenes to manage blood sugar, and that battle plays out while you're asleep. One of the biggest reasons this happens is glucose instability during the night. If your blood sugar drops too low or spikes too high while you're sleeping, your body can't fully enter deep restorative sleep stages, the ones your brain needs to recover and recharge. These fluctuations trigger microarousals, where your brain briefly wakes up just enough to interrupt your sleep cycle, but not enough for you to remember it. The result? You might think you slept all night, but your body never got the deep rest it needs, and you wake up groggy, mentally foggy, and drained. Another layer to this is how your cells are processing energy. In diabetes, your body either doesn't produce enough insulin or can't use it effectively. That means glucose, your main energy source, can't enter your cells efficiently. So even though there's plenty of sugar floating around in your blood, your muscles and brain feel starved. This leaves you feeling tired before the day even begins. It's like trying to start a car with a full gas tank but a broken fuel pump. The energy is there, but your system can't access it. And then there's the hidden impact of inflammation. High blood sugar, especially when it's constant, creates low-grade inflammation throughout the body, including your brain. That inflammation messes with neurotransmitters like serotonin and melatonin, which play a major role in regulating sleep. Over time, this chronic internal stress blunts your body's natural sleep rhythms, making your rest less effective even if you're technically sleeping for hours. You may not feel wired or restless, but you'll definitely feel worn out. According to an author manuscript review, up to 40% of adults with type 1 diabetes experience chronic fatigue. It's linked to blood sugar swings, poor sleep, pain, and depression. 6. Dry mouth, or a cottony throat upon waking. If you're waking up every morning with a dry mouth or that rough, cottony feeling in your throat, it might seem like no big deal, but when it keeps happening, and especially when it starts affecting your comfort or even your breath, it's time to dig deeper. That persistent dryness could be one of the earliest signs your body is struggling to manage blood sugar. One major reason for that dryness is dehydration caused by high blood sugar levels. When glucose builds up in your bloodstream, your kidneys try to flush it out, and in doing so, they also pull water from your body. This leads to frequent urination, which leaves your body in a constant state of water loss. During the night, when you're not drinking anything, this fluid deficit becomes more noticeable. Your mouth and throat are among the first places to dry out, especially because they rely on a steady flow of saliva to stay moist and healthy. But the problem doesn't stop at just losing fluids. Elevated blood sugar levels also directly affect your salivary glands. Over time, high glucose impairs their ability to produce saliva efficiently. Saliva isn't just there to help you chew, it also plays a key role in protecting your teeth, breaking down food, and maintaining the health of your gums and oral tissues. When those glands slow down due to diabetic stress, your mouth may feel sticky, dry, and even sore, especially when you wake up after hours without hydration. According to PubMed, 43% of diabetic patients reported dry mouth, mostly women. It was linked to poor blood sugar control, not age or nerve issues. Diabetics had lower saliva flow and more symptoms of dryness in the mouth, eyes, and throat. 7. Unexplained nighttime hunger. Unexplained hunger at night isn't just about willpower or eating late. It's a symptom tied closely to how diabetes affects your internal chemistry, especially when your body is supposed to be resting and repairing. The first reason this happens goes back to how your body uses insulin. In diabetes, either you're not producing enough insulin or your cells have become resistant to it. That means glucose, your main energy source, isn't getting into your cells properly, even though there's plenty of it floating around in your blood. So your cells signal to your brain that they're starving, and your brain listens. It thinks you're low on energy and responds by making you hungry, even in the middle of the night, when you should be fasting and conserving energy. That hunger is a survival response, not just a craving. Then there's the role of disrupted hormonal rhythms. Normally, your hunger and fullness hormones follow a pattern that matches your sleep-wake cycle, but high blood sugar levels may throw off that natural rhythm, especially when they're fluctuating throughout the day and night. Leptin, which helps you feel full, doesn't work as well when glucose is poorly controlled. At the same time, ghrelin, the hormone that makes you feel hungry, may become more active, even during nighttime hours when it should be quiet. This imbalance pushes your appetite when it should be off, making you feel hungry when your body actually needs rest, not food. According to research, frequent hypoglycemia, especially at night, is not just a complication but also an early warning sign of diabetes, particularly in those using insulin or sulfonylureas. 8. Leg or foot cramps during sleep. Most people think leg or foot cramps are just from a weird sleeping position or not stretching enough. But when they start happening often, especially during sleep, it could be your body waving a red flag about something deeper. The first reason this happens has to do with poor circulation. High blood sugar damages the lining of your blood vessels over time, making it harder for oxygen-rich blood to reach your muscles, especially in your legs and feet. When those muscles don't get enough oxygen, they become more prone to cramping, especially when you're lying still and your circulation naturally slows down. Your legs basically go into mini panic mode, sending off pain signals to get your attention. Furthermore, diabetes often causes early-stage nerve damage, known as peripheral neuropathy, and that damage interferes with how your muscles receive signals from the brain. When those nerves misfire or go silent, your muscles may spasm suddenly, especially during sleep, when your body's in repair mode. And since nerve damage tends to hit the longest nerves first, your lower legs and feet are often the first to show these signs. The cramp isn't just uncomfortable, it's your nervous system struggling to maintain control over muscle activity. The third factor that connects diabetes to these nighttime cramps is how it throws off your body's balance of essential minerals. Chronic high blood sugar affects how your kidneys process and retain electrolytes like magnesium, potassium, and calcium, all of which are crucial for normal muscle contractions. When these levels drop too low, even slightly, your muscles become irritable and hyperactive. That's why even minor imbalances caused by diabetes may lead to cramping episodes that strike when your muscles should be relaxing the most. According to Dove Press, 48% of people with type 2 diabetes had muscle cramps, especially those with diabetic eye disease. The cramps are linked to poor blood flow, making them a possible early sign of diabetes circulation problems. Moving on, let's discuss 5 powerful foods that help keep your blood sugar stable. If you're like me, you've probably wondered what simple foods you may eat to avoid sugar spikes and feel more balanced throughout the day. However, you don't need expensive superfoods or complicated diets. You just need the right everyday ingredients that work with your body, not against it. In this list, I'm sharing 5 powerful foods that you may start eating today to help keep your blood sugar in check. 1. Chia seeds. High in soluble fiber and omega-3s, chia seeds slow down how quickly sugar enters your bloodstream. They form a gel-like consistency in your gut, which helps improve insulin sensitivity. 2. Lentils. Packed with resistant starch and plant-based protein, lentils help regulate glucose response after meals. They're also low on the glycemic index, making them perfect for steady energy. 3. Avocados. Full of healthy fats and nearly sugar-free, avocados help blunt post-meal blood sugar spikes and support insulin function. 4. Cinnamon. Just half a teaspoon daily may improve insulin sensitivity and lower fasting blood glucose. It's a powerful spice that's easy to add to oatmeal, tea, or smoothies. 5. Okra, aka Ladyfinger. Okra contains compounds that may reduce sugar absorption in the gut. Some people even drink okra water to manage their glucose levels naturally. These nighttime signs might feel random or easy to brush off, but when you look at them together, they often point to one major issue: your body struggling to manage blood sugar properly. If you're noticing 2 or more of these symptoms, or someone close to you is dealing with them night after night, don't ignore them. It could be an early sign of diabetes or prediabetes. I know it's easy to dismiss things when they don't seem urgent, but catching these red flags early may make a huge difference. You have the power to take control before it turns serious. Don't let the quiet of the night cover up what your body is trying to warn you about. Now that we have discussed the many nighttime signs of diabetes, let's keep the conversation going with a couple more videos, shall we? Watch 10 foods to flush out toxins from your liver. You may also try our video on 11 worst daily morning habits you must avoid. Go ahead, click one. Or better yet, watch both and learn more about our health. What other nighttime signs of diabetes do you know? Let us know in the comments below.